I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change. And these are the critical conversations about health in our community with the people who can help me make those changes. Good afternoon. Welcome to CEO Live Talks with Dr. Swannie Jett. I'm your host. I'm here with Dr. Ted Smith. Welcome to episode 2. So, how long did you live in Chicago?
I think I was there for 6 years.
Did you enjoy it?
Well, you know, I was out in the suburbs. So, I mean, anytime I talk to anybody who actually lives in Chicago, I mean, they're just, you weren't in Chicago.
Right.
Just constantly
right.
dismissed. I mean, you lived in it was a cornfield, 20 years before that. I mean, living on that. And that was the western edge. Right. Today it goes all the way to the Call. I mean, it's just like, it's a whole different thing. But yeah, I mean, the people that live in Chicago, and people live in Chicagoland. So, I mean, I thought it was great because you could have the best of both, right? You could head into the city for, city things. Right. But you could, have a peaceful home existence the rest of the time.
So what was your favorite restaurant there?
You know what? It has been too long.
Okay.
I'm not going to be any good for you.
So I could tell you mine is Giordano's.
Okay.
So I'm always at Giordano's and Garrett's Popcorn. So if you don't eat Giordano's pizza, Garrett's Popcorn.
Wow. I mean, they're notorious for pizza.
Right,
so, I mean, it is, well, as a public health professional, it's interesting that you're confessing this.
I'm confessing this.
I mean, it is about as calorie dense as you can make a pizza.
It is. And that's why I can only do it 3 times a year. But I can do that because I'm a native of Chicago.
Oh, I see. Well, there
So
you go.
I grew up
Somehow in your epigenetics.
It's
right.
It calls me.
I see it. Oh, my goodness. Oh, my goodness.
So it's a little bit different. And being an agriculture person and studying ag engineering, I can tell you that they made the popcorn addictive. So you can't just have one. So people don't know that we can actually make food addictive where you can eat more than just one.
Oh yeah,
and then that's a problem.
Goes right to the brain.
Lay's chips is a good example.
Yeah.
So when you left that job, well, first, were you successful at setting up a virtual reality lab?
It's so hard. I mean, I guess we all pick our own definitions of success. So I mean, we had a bunch of patents on the work that we did. I thought it was it was an effective training program we built with these VR, headsets and all that. I think for me, it was an opportunity to show that I could work in the private sector. I wasn't a scientist in the nerdy sense of the word scientist, right? I understood that the kinds of things you learn in graduate school are more about critical thinking, right? How to evaluate evidence. I mean, it wasn't about the science subject matter, right? It was about the scientific process, right? So I actually thought that it really made the work that we did better, because we were a lot more, I think, thoughtful about what we were doing. So yeah, I mean, I was on my way to associate partner, and then I got sucked away in the .com to a tiny company in Minneapolis, and so that was the end of my big business time.
So and this is something that don't usually happen. You graduate, go into the private sector, and you drop right into management. Right.
Oh, I remember going to new manager school at Anderson, and with the managing partner of the firm, this guy flew in from wherever, and we just got a lottery pick to who's going to sit at this table. And I'm sitting there, and I'm the only one who hadn't crawled over the backs of everybody else to get at that table, right? Wow. And so you can only imagine how disappointed he was. Right. It's like, so tell me your story for rising to management. I'm
just graduated. I love you.
Kind of just got here. Hey. Somebody in HR made a mistake. I mean,
that's hilarious.
So I think that's sort of telling, right?
Right.
What
did you learn? Because one of the most critical elements of, for our kids now graduating. When I left University of Tennessee, I started managing people, and then they were twice my age, right? So, what are some nuggets you would give yourself, or give your sons coming up now in terms of what to do? Because there's some hard lessons.
Look, I think the older you get, the deeper the appreciation you have for respect, for others, right? Mm-hmm. And I think you can always tell an immature manager, because they actually take the authority part very seriously.
Very seriously,
right?
yeah.
And I think the truth of the matter is, we're all in this together.
Right.
And if I don't have a sense of empathy, and if I don't feel like I understand what I'm asking somebody to do, like that I really know what I'm asking somebody to do, it's hard to imagine that you're going to be successful, right? Because people can sense when it's arbitrary or when you're not sweating as hard as they're sweating, and so it's important. Humility, all those kinds of things, really important.
Yeah, it's very interesting. I have conversations. Of course, I'm still on the military side of the Air Force, and I have to tell people sometimes, like, you barking out orders, but they don't see you helping them with anything. So that's not a good perception. And they're a little bit older, so you would think they would know.
Yeah.
So when you left Anderson, what did you do next?
So a little startup company up in Minneapolis. That was what everybody was doing back then. So this was 1999. The stock market's roaring. Everybody's building websites, and everybody thought they were going to get rich. Doing a startup company, right? And I got sucked into all that, and I did that for a little while, and ended up here in Louisville because the company that I was running up in Minneapolis ultimately sort of folded into a company that was acquired here called Tech Republic, and I actually moved down with the acquisition. They said, why don't you take a look at it and see if there's something you want to do? And I came down, and I just fell in love with Louisville. And it was because it reminded me exactly of Pittsburgh.
Okay.
Like neighborhoods, river, rust,
exactly
air pollution, all of it. It was starting to rhyme.
Right.
And so I was delighted to move down here. We started our family at that time. And I really have pretty much stayed here ever since.
Okay. So, it's interesting because you're super smart, highly off the charts intelligent, So I'm just curious, why jump into .com?
Well, how smart am I, right? Yeah, you better start taking some of that back. Yeah, no, I think, this might sound a little corny,
Right.
but one of the things I love about science is the unknown. Right. So there's mystery in science, right? That's actually what fuels people. Like, I want to figure this out. Right? It's a puzzle, right? Okay, so I love that about science. I love figuring stuff out. Well, in the private sector, entrepreneurship is a lot like that, right? So I bet there's another way to do this. I bet there's a way to figure this. I bet there's a way to take this technology and do this. And to me, it's exactly the same kind of adrenaline, the same kind of rewards, of dopamine. I'm sorry?
More risk. That's your daddy.
Yeah, and risk. No, absolutely. And risking your money, other people's money, right? I mean, the stakes are different, and I think they're high. So I think I sort of fell into, like, just that was the thing I was trying. I was trying a different drug.
Right.
And so, yeah. But, at the end of the day, I'm sort of glad that the world sort of came to its senses, and we go through these cycles where we lose our minds and then we get them back again. So.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at Park Duval Community Health Center. Ever since I started at Park Duval over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
Hello, I'm Dr. Swannie Jett. Please make sure you visit one of our 5 locations, not only in Louisville, but outside of Louisville and surrounding areas. Thank you. So you leave that world behind. So what made you branch into University of Louisville?
Yeah, so this is actually the happiest chapter of my life, really looking back. And that is, I had worked, so there was the website stuff at Tech Republic, and I'd started a company, and there's a little chapter in there. That's all good and fine. But if we fast forward, I worked for 6 years for Mayor Fisher in his first term and a half. And I was the city's chief innovation officer. And that was like a new title, which I think is probably more problem than good in some senses, right? Because people are like, well, we didn't used to have one. Why do we need one? Whatever. So
You always need an innovation officer.
I mean, it's like having a bullseye just put on your back, right? I remember going over to Metro Council, and I got this interrogation. They're like, well, Dr. Smith, what innovations do you have scheduled, right? Okay, I mean, that happened.
Wow.
What innovations do you have scheduled? I said, well, sir, if you could schedule innovation, we wouldn't be in a recession right now. And so, and I mean, that's just the truth of it. Is it became a little hyped.
You
right?
were very polite, because I'd have said something like, I'm trying to innovate how to not make you speak.
Where were you? I could have used a little coaching like that. A little
You'd be like,
earpiece.
whoa.
Yeah. I mean, this was hard. It was really hard. But so some time in the public sector, but working, doing that work, that's actually what got me into air pollution. I developed a professional relationship with Mrs. Christy Brown. She had just lost her husband to what she believes a COPD exacerbation driven by air pollution, ultimately ended up with MRSA, killed him. And so, she had a passion for like, well, Louisville can be better. We don't need to have air pollution.
Right.
People shouldn't be incarcerated in place in an environmental terrible, like, so let's take some ownership for this. And I give, Greg Fisher a lot of credit for giving it room, because as I know well, there's a great history of tension between job creation and polluting the environment.
Right.
And, most of the time, we've ended up favoring job creation over pollution,
Correct.
right? And so I had a little room there, and we figured out that right here in Louisville was one of the world's authorities on air pollution, and his name is Dr. Aruni Bhatnagar. And Aruni, he had started his career in tobacco, studying the effects of tobacco smoke on the cardiovascular system, which then immediately parlayed into air pollution research, because it's all sort of the same thing in a sense. And, as a world authority on this stuff, National Academy panels, NIH expert, and nobody here knew, because he was in his ivory tower over there at U of L, nobody knew. He was resentful, I think, at the time, that nobody knew his name and how famous he was. And so it would actually take somebody like Christy to, because she's very kind of on the ground civic person, to bring him out of the ivory tower. And there was a point in time we almost lost him and his team to a very famous university in the Northeast. And we worked hard together to figure out how to make a circumstance here that team would stay in Louisville. And that ultimately became what we call the Christina Lee Brown and Byrom Institute. And it was a mechanism to give these researchers the things that other universities were willing to give them. And that environment, so I joined that at the moment we created it. And it's about 7 years old now. It's the largest independent research organization at the university. It's amazing. We're about 110 people. We're really all around environmental health. And it's just really fulfilling work. It's what I liked about working in the city, for the city, combined with trying to be part of a larger community, globally, who's really trying to, make the case for why we should live in healthier environments.
Yeah, I sort of remember a little bit about, at least because I was coming back and forth. I left in 2013 to go to Seminole County, Florida, to be the health commissioner. And I had worked with Anita Gasson, because I was on the West Jefferson County Task Force. And we were looking at how we can expand the research. Because one of my goals was to do a longitudinal study to actually have people wear monitors to be able to detect the type of air or environment they were in for how long.
Yeah.
And then follow them for at least 10 years and to see what developed. But I know that would have been very costly research.
Well, and also a little bit ahead of its time. I mean, today you have NIH interested in this concept called the exposome, which is exactly what you were saying. And now we have come to realize that we don't really know much about the daily lived experiences of people, yet we know how critically important those experiences are and how they accumulate and how they produce health or disease. And so what you are advocating for is now in fashion.
Wow.
So I mean, think about dusting it off, because we're
I
starting to
wrote
see
that,
more of that.
into my dissertation in 2009.
Yeah.
So I was thinking, because
Way
at this
ahead.
time we looked at heart monitors, well, we looked at air monitors, and I can't remember, I think we had like 23 different chemicals that people might have been exposed to with carcinogen. I'm sure there was a lot more than that. But they could never make a causal relationship. So it was just mainly an association.
Yeah. No, that is one of the great challenges that we all have. So, at the end of the day, I'm very sympathetic to anybody who says, I'm a little concerned, that whatever's coming out of that smokestack or whatever's coming out of the ground, I'm concerned for my health and my family's health. Back to the management lesson, like, step one, with all empathy, right, is, then this is a really important matter. Like, your lived experience is critically important. How do we bring the level of science necessary to stop it? And I think that's actually what is torturing me in this chapter of my life. Is it's easy to do associative studies. They're done all the time. Right. And they, in the case of environmental justice, they get dismissed regularly because they can't prove cause, they can't prove harm. I mean, it's just not the strongest science you can bring. And so, I mean, I completely agree that I think we have a responsibility. We have training in these different tools. We know that the world uses this for and against you, same tools, right?
Same tools.
And so we really have to bring a bigger game here. And that's why I'm delighted for the work that we're currently doing.
Right.
Because we're really trying to now move from air monitoring to establishing proof biomarkers of exposure. Right, and that's some of the work that we're doing in the sewers. That's some of the work that we're doing in South Louisville with human urine samples with volunteers who participate to do that work. Because if we can show that people have been exposed to these chemicals, then I think you're a lot closer to compelling evidence that either a regulator or a civil litigator or somebody needs compelling evidence of harm. Right. And I think it's sad that we have to prove somebody's harmed before we can get something fixed. That's very sad. But I do know that those associative studies just have had a limited life.
We're out here today. It's a beautiful day. Beautiful day to be out in the park, at Algonquin Park, exactly, right across the street from Park Duval. It's just Appreciation Day. We're showing the employees from all of our locations that leadership appreciates the hard work that they do every single day that they step through those doors, right? The goal is to make sure that we put patients first, and secondly, is that we put our employees, right? And this is a great way to show them that we do care about them, their welfare, their mental being, their physical being. It's just a really good feel event.
So today is an absolutely amazing day for Park Duval. We came together as one to be a team. This is some great team building for us. We came to have a good time, have some fun, bring everybody together so we can laugh, dance, eat, and then just enjoy the day. So we're having a day in the park. That's what we do. We come together as one.
Today's event's more for everybody to just come together and love each other, show each other that we're all in this together, to very much just build more camaraderie. We're going through a culture change here at Park Duval, so this is a part of that culture change and showing each other that we're not working against each other, but we're working with each other, and obviously getting to know each other a little bit. We have a lot of staff coming in, so now we're getting to know our new staff, and some of our old staff is getting to know each other as well.
We are with Park Duval. We out having fun. We got cornhole, we got kickball, we eating watermelon. Yes, that's a cliche. We eat watermelon, but we also got a lot of great food, bratwurst, chicken, everything. So this is what we call a mental health day of relaxation. So I'm glad everybody was coming out here to enjoy, have fun, peace, and with.
We are here in the community. We partner with our community health workers to run vaccination clinics throughout the city of Louisville, specifically downtown and the West End. The importance of events like these is that a lot of people have transportation issues, so we are able to come out into the community and get people the vaccinations that they need.
So it's really important to have these type of events in the community because, you know, as we know, when COVID and flu season comes around, our underserved communities are hit the hardest. So if we can bring any vaccines or anything that they need, glucose testing, it's important to meet people where they're at.
At Park Duval, we care about the community. We do events like this monthly because we are the community and we love to give back to the community.
Be sure to visit our website for more of our upcoming community outreach events.
For more information, visit us online at pdchc.org.
So let's talk a little bit about I know we have several research projects out there, but what is your top research project that you're working on right now?
You know, this is really hard because, you know, we love all of our children. I love all the research projects.
All of them.
Well,
I mean, the same.
Well, I mean, I'll be selfish here and say, you know, the work, we've got this environmental justice EPA grant together. We're collaborators on that with the Air Pollution Control District, with the West Jefferson County Community Task Force. What I'm so excited about that project is it's not only a chance to sort of update some work that had started a long time ago, but I think it's an opportunity to upgrade the nature of the work that we're doing, and it's because we're doing it together. And with you specifically, I'm so excited. I mean, really, I can't contain myself. The opportunity to bring some of this stuff into the clinical setting.
Right.
Nobody's doing that anywhere in the United States of America. I mean, this is a tremendous opportunity.
Well, a lot of people are scared to do it. And then I did see recently part of the government, I can't remember if it was the EPA, but they really wrote guidelines. I just read it, can't remember the exact, that they want to include more African Americans in clinical trials. Because a lot of times we do studies and they say we need 2,000 people, and then we want to extrapolate the data to make sure it's applicable, but then you can't do it based on the limited demographics.
Yeah.
So I'm excited about that. I think this project has promise. Of course, it probably needs a little bit more money to make it fruitful.
Yeah. Well, I mean, I think this is an important door that opened. And I think while that grant is a limited duration grant, I think if we really get the community excited about really learning these lessons, I mean, learning them, I think there's a bright future for really thinking differently about our places.
So I have to ask this. What keeps you up at night?
Well,
because you're living in Louisville.
Well, this is going to sound very, very trite, but I mean, our national politics keeps me up at night. I'm very concerned that our country is divided, kind of pretty deeply in many places, and I really do think our democracy is a special is a special kind of government, and really it has made really great and terrible things possible. Right. But I think of all the things that we really need to be protecting, I think our democracy is one of them. And so I'm really concerned about that. Because my job as a scientist depends on us having a democracy, right?
It does, because we're speaking for people who sometimes can't speak or don't understand. So, I saw something interesting the other day. It was a room full of people, and the professor just pointed one person out, told him, "Get out. Don't ever come to my class again." And then he asked the students, "So, was I wrong?" And they was like, "Yeah, you were wrong." And then he asked, "What did y'all do about it?" And they said, "Nothing." So you just watched an injustice occur, but you never thought to speak up about it. And that's why I think our work is special. And of course, we got a lot of problems to solve in Louisville, so I'm up about that at night. But we have to speak about the injustice going on because there's a lot of people that won't.
Right.
And that also puts a target on your back.
Right.
So I remember as a health commissioner, you solving public health problems nobody wants to talk about.
Well, and I think that's really well said. I also think that there's a kind of naivete that we don't understand that when there are injustices like this, everybody pays.
Right.
And I don't know why people don't understand that.
Right.
But like, so the idea that there is a houseless person downtown, and I feel like, well, that has nothing to do with me. That's of course crazy, right? And so as a society, I mean, we're all going to be paying for these injustices.
Right.
All of us. Now, some more than others, but the idea that it's not my problem, and I find it inconvenient to talk about your problem, like it is our problem.
Well, you're paying for it one way that's coming out your taxes. And last time I checked, I haven't gotten an itemized report back from the federal government where my tax money went.
Yeah, I mean, being unhealthy. I mean, this is something we all care about desperately. I mean, being unhealthy is the biggest drag on our productive society, for sure. And I mean, so why aren't we investing in resolving health inequities, right? Why aren't we? And I know you have a great history. You've worked with some really famous people in this field. We aren't learning the lesson that health inequities are holding us back from being a competitive and productive society. It's not simply a justice matter, not to understate justice, but like it's a big, important issue.
Well, it's
right?
prevention, and if we don't prevent, we put more money into treatment. We're not solving anything.
Right, we're going to be diagnosing and treating things forever.
But that's the economic cost. I hate to say that, but you know, people profit.
People do talk about our disease care system, right?
Yeah,
our healthcare system, right?
Yeah. So, if you were to do anything else besides the current research, what would you like to solve in terms of your field?
Well, I mean, the
astronauts are fine now, so I'm going to say that.
Are they fine? I mean, now we're sending all kinds of people to space. It's actually getting interesting. Now we're sending everyday unhealthy people to space, not just like
we're going to live in Mars, so I'm prepared.
Yeah. Well, I think it's, and again, maybe the older I get, the more I'm tortured by all this, but I do go back to the NASA stuff, and I do think about the trip to Mars, and I think about how little regard we've had for our dependence on the rest of our ecology, on the rest of each other. And I think it's almost simply arrogance that we think, well, you know, I'm in charge of my own health and destiny, right? Like, I mean, what is your dependence on all the microbes that are in this room? We can't answer the question. No. We don't know. But if you put somebody in a can and send them to Mars and we scrub it all out, we're going to learn. We're going to learn whether we need all. So Noah's Ark is taking on a whole new kind of meaning now. Like, do we need all the other things for us to be healthy?
Just put a camera on them. I'm going to sit right there. I'm not taking that trip or that risk. Some things is not worth it.
I'm with you on that one.
Well, Dr. Smith, thank you for coming to the show today. I really appreciate our conversation. This concludes our show today. Thank you.